Communicable diseases, also known as infectious or transmissible diseases, are illnesses caused by pathogenic biological agents, like viruses, bacteria, fungi, or parasites, that spread from one person or animal to another, or from contaminated surfaces, bodily fluids, insect bites, or through the air. Here's a list of common communicable diseases, many of which are prevalent in the Philippines. Common communicable diseases. Respiratory infections. Influenza, flu, viral infection affecting the respiratory system. COVID-19, caused by the SARS-CoV-2 virus, affecting the respiratory system and other organs. Tuberculosis, TB, bacterial infection primarily affecting the lungs, spread through airborne droplets. Pneumonia, inflammation of the lungs, often caused by bacterial or viral infections. Pertussis, whooping cough, highly contagious bacterial respiratory disease. Measles, highly contagious viral disease, spread through airborne droplets. Mumps, contagious viral infection causing facial swelling. Common cold, viral infection of the upper respiratory tract. Diphtheria, bacterial infection that can cause a thick covering in the back of the throat. Hand, foot, and mouth disease, HFMD, viral infection common in children. SARS, severe acute respiratory syndrome, viral respiratory illness. MERS, Middle East respiratory syndrome, viral respiratory illness. Vector-borne diseases, transmitted by insects or animals. Dengue, viral infection spread by Aedes aegypti mosquitoes. Malaria, parasitic disease spread by Anopheles mosquitoes. Leptospirosis, bacterial disease spread through contact with water or soil contaminated with animal urine, often during flood. Rabies, viral disease transmitted through the bite of an infected animal. Zika virus infection, viral infection spread by Aedes mosquitoes. Chikungunya fever, viral infection spread by Aedes mosquitoes. Japanese encephalitis, viral brain infection spread by mosquitoes. Filariasis, parasitic disease spread by mosquitoes. Lyme disease, bacterial infection transmitted by ticks. West Nile virus, viral infection spread by mosquitoes. Waterborne and foodborne diseases. Cholera, bacterial infection causing severe diarrhea and dehydration, spread through contaminated water or food. Typhoid fever and paratyphoid fever, bacterial infection spread through contaminated food or water. Acute diarrheal diseases, for example, norovirus, rotavirus, E. coli, salmonella, infections causing diarrhea and vomiting, often spread through contaminated food, water, or direct contact. Amoebiasis, parasitic infection of the intestines. Schistosomiasis, parasitic disease acquired through contact with contaminated fresh water. Sexually transmitted infections, STIs. HIV/AIDS, viral infection that weakens the immune system. Hepatitis B and C, viral infections that affect the liver, some types can be sexually transmitted. Syphilis, bacterial infection. Gonorrhea, bacterial infection. Chlamydia, bacterial infection. Genital herpes, viral infection. Genital warts, HPV, human papillomavirus, viral infection, can cause certain cancers. Other communicable diseases. Hepatitis A and E, viral infections affecting the liver, often spread through contaminated food or water. Chickenpox, varicella, highly contagious viral disease. Mpox, monkeypox, viral disease spread through close contact with an infected person or animal. Meningitis, inflammation of the membranes surrounding the brain and spinal cord, can be viral or bacterial. Leprosy, Hansen's disease, chronic bacterial infection primarily affecting the skin, nerves, upper respiratory tract, eyes, and testes. Scabies, skin infestation caused by mites. Tetanus, bacterial infection that causes painful muscle spasms, often from contaminated wounds. The Philippines, like many tropical countries, faces a significant burden from infectious diseases, particularly those spread by vectors, like mosquitoes, and those related to sanitation and hygiene. The Department of Health, DOH, actively monitors and implements programs for the prevention and control of these diseases.